Ready? Good evening, everyone. Today we are going to do angiography. This is our cath lab. This is our staff, Dr. Joshi, Dr. Hingne, and myself, Dr. Amol Kothalkar. So, angiography is a uh, basic procedure we do in cardiac catheterization. It is called as left heart catheterization. In angiography, we normally see where are the blockages in the coronary arteries and what can be done for such patients. Depending upon the angiography, we send the patient for either medical management, angioplasty, or bypass. If the blockages are acute, then we have to, acute means if it's like a patient is having acute coronary syndrome like myocardial infarction, unstable angina or NSTEMI, then we go for angioplasty, or if the blockages are more, then we have to send the patient for bypass. The basic procedure of angiography consists of a basically we have the sheath. uh, this is a sheath which we put in the patient's radial artery or femoral artery, and this is a catheter. What Dr. Rishikesh in the morning said is a coronary angiography catheter. It is a tube which we take to the coronary artery opening, and there we put the dye, and then take the radiology shoots. So now we will start the procedure one by one. First, we will take the radial artery puncture. Radial artery puncture. We'll take the right radial artery and we give an anesthesia, local anesthesia, and then we take a puncture, artery puncture. बाबा थोडं सुई लागेल हा. बस 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 थोडंसं दुखेल, हालू नका फक्त आता. घे रे, हे घे पंक्शन. This is arterial blood. It is pulsating blood, red blood, and we are sure that we are into the right position. Then we will take a blade to widen the opening so that the sheath goes easily. sheath. बाबा थोडं दुखेल हा, थोडं दुखेल म्हटलं, आग झाल्यासारखं वाटेल. बस बाबा 2 मिनिटाचं काम आहे. कॅल्सिफिक आहे तुषार खूप. बस 2 मिनिटाचं काम बाबा. बघू. सो बस झालं बाबा, 2 मिनिटाचं काम आहे. 15 मिनिटं फक्त, इथून मोजून 15 मिनिटं. हा, कॅल्सिफिक आहे तुषार, रेडियल आर्टरी कॅल्सिफिक, व्हेरी फ्लश. स्टॉप. त्याच्यावर फोकस कर. बस बस बस. So this is a basic monitor. The green is showing the heart rate, then yellow is showing the respiratory rate, and blue trace is showing the blood pressure, oxygen saturation. And the lower you can see the arterial blood pressure, that is 125 by 59, and that is 84 is the mean aortic pressure, mean arterial pressure. Now we are going slowly from the radial to screen. आता स्क्रीनवर या, इकडून जाते वायर आता बरोबर इझी. So this is wire which is going from the radial artery to brachial artery. Then we'll follow the wire tip. You can see now we have come back to the ascending aorta. Now my wire tip is in the ascending aorta. This is we are into the ascending aorta. Then we will try to hook the right coronary artery first. ठीक है. Okay, so this is right coronary artery, and then ostium, you can see a very tight lesion in the ostium. It is called as there is a tight stenosis in the ostium. फ्रीज कर तुषार, मॅग केलं होतं तू, स्टॉप कर, फ्रीज कर. हाँ, you can see that just after the origin of the catheter there is a stenosis, and after that there is a vessel size is more. So that is a very arrow pointing is a very tight 90-degree stenosis in the right coronary artery. This patient will require some sort of revascularization depending upon his other artery other arteries. Now we have hooked the left coronary artery. Left coronary artery divides into the two main branches, that is LAD and LCX, left circumflex coronary artery. Left main coronary artery we are now injecting. Left main coronary artery is very nice. It is dividing into, here it is dividing into three branches, that is left circumflex, ramus intermedius and left anterior descending artery. Left descending artery of the patient also has tight lesion. तो वायर हटवा, हाँ ठीक, वरती है, okay, ready? This is, now we have injected into the left coronary artery and there is a tight stenosis of the left coronary artery from the ostium. दाखो इधर, freeze कर, stenosis दाखो, freeze कर. That there is the arrow दाखो, stenosis for stenosis arrow, तिथं, हाँ खाली दाखो, खाली मत रन कर त्याला, रन कर, थोडं रन कर, खाली भरू दे, LED भरू दे थोडीशी, stop. Now you can see there is a tight stenosis, arrow ने stenosis for, and there you can see arrow, खाली trace करे arrow ला, खाली lumen वर आण, lumen और खाली भरती है LED, that is next, LED is next, तिथं. So now arrow is pointing to the vessel, त्या खाली आण ना थोडं, pointer खाली आण, बस तिथं stop, वरती ने सर handle का, बस तिथं stop तिथं. So that is a very well filling vessel, and above that you can see there is a very tight lesion. So this patient has a double vessel disease, epicaudally. So LAD is totally diseased, RC ostium is totally diseased. This patient is going to require revascularization. He is a case of a carcinoma of lower jaw. He has a and before surgery, the surgeon wanted a cardiac clearance, and in cardiac clearance he was suggested angiography. Now he will have to first undergo whatever he will have to undergo revascularization in the form of either angioplasty or a bypass surgery. Then he will have to undergo surgery for the carcinoma of the jaw. So that thing will be taken care. The plan will have to decide with the oncology, cardiac surgeon, and multidisciplinary approach. We have to approach this case. Okay, this is the first case. Second case we will start after some time. ठीक. झालं ना?